You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures, according to my first guest. We're talking about dental implants today. According to him, if you're missing a few teeth, and especially if you have a loose-fitting denture, you have to find out more about dental implants. With us, we have an expert on the topic. He teaches other dentists about dental implants, Dr. Kui Key. Dr. Key, welcome to the program.
Thank you, Randy. I'm excited to be here. Thank you for having me.
Okay, good. And you brought your whole family to the studio, and that's nice.
Yes, I do, right there.
And they say that you're funny. You're a very funny guy.
I try to be.
You have a good sense of humor, that's right.
Yeah.
Now, for people that don't know your practice, because I know you brought a lot of photos and models, who's the typical patient? Because you do more than just dental implants, right?
Yes, I am a general dentist by training.
Okay.
We do some simple whitening to enhance your smile, okay, to bonding, for those who are very scared in seeing the dentist, we also provide anesthetization, which is a light sedation to get you through the procedure very comfortably. Other things that we do is root canal, extraction, and a big part of our practice is dental implants.
I mean, I've seen your photo of your building. I mean, you've got dental implants written right
Correct.
on the door.
Yes.
I mean, you're like the implant guy.
Yes.
Is that right, for Northern California?
For Stockton Valley, yes.
Okay,
Central
good.
Valley, yes.
Is that most of what you do, dental implants? I
Yes,
mean, you've got the reputation for that?
Yes, 40% of my practice is dental implants, and I do have the opportunity to also train other dentists through the years since 2003.
So in your area, are there a lot of people wearing dentures that would benefit from dental implants?
Definitely, Randy. So many people are stuck with dentures that doesn't stay in place. So with dental implants, we can provide them, change their lifestyle, transform their eating habit, their social life, and we've seen great result over the years. And people told us directly that how the dentistry we provide just lighten up their life, their social life.
So we spoke on the telephone.
Yes.
And you said that there's probably, in fact, in the green room, you told me there's like tens of thousands of people within an hour of your practice or right near your practice that have an upper lower denture. And if dental implants are so good, why aren't they all doing it? Why aren't they getting, something to, attach that denture on? What's your take?
Well, Randy, that's a great question. There's thousands of people everywhere, in the valley that has denture. The question of how come they don't get it is most likely is education.
Okay.
A lot of them are seeing their last dentist the last 15 years because once you have a set of denture, you mostly say, you know what, that's my last chance of visiting the dentist. So they don't look at as, you know what, I still need continued care because the denture become loose over time. And since they are wearing a denture, they say, well, why do I need to go see a dentist? Even though they're not getting by socially.
So what are the different categories of dental implant patients that you see?
The category range from single tooth, if you have an accident or a root canal tooth that failed and it broke, to 2 teeth and 3 teeth and 4 teeth, many types. For the denture wearer, 2 would be the least engineered to be efficient.
So a full arch of teeth?
Correct.
Just 2 implants?
2 implants.
And what, they snap in, snap out?
Yes, the 2 implants, what's going on with the denture is that you have a loose bolt that's always rocking without anchorage. So with 2 dental implants on the bottom, the patient can just snap that in, it'll hold it down while they can talk without it popping out of their mouth.
No more adhesive?
No more adhesive, yeah. Dental implants is a anchor and there's a adapter inside the denture that you just snapped in.
Okay, now you brought models. Do you have a sample of what that looks like?
Yes, I do.
So this right here.
This is a 2 implant anchorage.
Okay. Is this an exaggeration? Is this actually how hard it would be to pull off?
That's exactly what's going on in the mouth, yes.
Interesting. So it just snaps on. But some people have like arthritis. It must be tough to take out.
True. Now,
so what do you
do? To help that, the manufacturer made different retentive features on the mechanism, so we can lighten up by pounds. It can go to like the one you took out is probably 8 pounds of resistance, and we can go down to 6 pounds and 4 pounds, whatever is conducive for the patient to able to maintain it, take it out, put it out, take it in.
Okay, now how old? Okay, so a denture, you get a full arch of teeth, and it snaps in. How old can you be to do this? Like, what are the age ranges?
As long as you're alive, we can do dental implants.
Really?
I have
Like a 90-year-old could do it?
Correct. My oldest patient was 96.
Really?
And I did 2 implants there. And that was the best gift for her because through the years, who knows, 15, 20 years ago, of suffering on the implant never being steady. You can imagine how hard it is to chew food when there isn't any stability.
So this was a 90-year-old woman with a denture.
Correct.
And you gave 2 implants just to snap in, snap out.
Yes.
Interesting.
Change her life. She can go out and eat, enjoy dinner, enjoy a nice social time with her friends without worrying the fact that her denture might dislodge.
What about pain? It seems very painful.
You know, over the years, no complaint. It's easier than pulling a tooth. As far as recovery, patients said, hey, I took 1 ibuprofen or 2 ibuprofens, and the rest was like sore. So, you know, the human body is pretty intelligent. I mean, there's a lot of nerve to feel and touch. There's nerve on the gum, but as far as the osseous or the bone content of it, there isn't any nerve that bothers.
So it doesn't hurt. That's why it doesn't hurt.
It does not hurt.
Now, but if you're older, 80, 90, are they more likely to fall out? The dental implants?
No. As you get older, your healing is a little slower. So as a practitioner, I gauge that through their life. If you're 18, 19, if you remember when you're 18, 19, I mean, you can go forever. I mean, you'll play sport, hang out with your buddies, and still get 2-3 hours of sleep and able to recover well. Now, as you get to be my age, in my mid-40s, things are a little slower to recover. So we gauge by that. So when dental implant goes in, a patient like myself, I wait a little longer than if my patient was 18. 9-year-old, a little longer. Okay, for the body to say, you know what, I really like this part in my mouth, so I can grab onto it. And the term is called osseointegration, a long term, but what it's saying is the bone cells like the dental implants and it's grabbing onto it. As a clinician, I like to always wait a little longer than going in a day earlier. The example I give to all my patients that ask that great question is like pouring concrete. Okay. When you pour cement, you allow it to set. If you go in there a minute earlier, you rock the post, then it doesn't set. So now you got to re-pour. So same thing in the practice. I always tell, hey, Randy, it takes a process. Okay, you lost that tooth. It takes time to lose that tooth. It wasn't instantaneous unless there's an accident.
Okay.
Yeah. So let's not rush things. Okay. So let's wait. If I wait just at the perfect time, in your case, probably 3 months.
Okay.
Okay. Because of the great engineering nowadays. Now, when I did implant 2000, I would wait a lot longer, just because of the design. Okay. People got a lot smarter. They understand the biology better to design the part to make sure that it heals a lot faster.
But are there cases where people could go and get the teeth the same day?
Yes.
There are?
There is. I've done that through the years, but a very small amount of limited case.
You think that's more of a marketing thing? Like when I hear and I Google the teeth in the same day, everything's in a day, everything's fast. What are your thoughts on that?
I do have my strong opinion on that. Anything fast, I see is a problem. Okay. Because the body needs time to adapt.
Okay.
To say thank you for abusing me. Okay. But if you do anything fast, the body's going to say, you know what, I don't like it.
So wait a couple of months, the bone grabs onto that dental implant, and then you can eat what? Whatever you want?
You can eat anything you want. You can eat corn on the cob. You can eat Chinese food like I do every day. Okay. Pretty amazing. It's actually very sturdy, and it's practically stronger than your own tooth. Because your own tooth, there's a mechanism called the PDL where we can pull the tooth out pretty easily without pulling the bone out. Now, once the bone grabs onto the implant, there is no way we can pull it out.
Is that right? So it's strong, just like a regular tooth.
Strong.
And they can last for how long?
I've always say forever, but in life, it always needs maintenance. Okay, your own tooth was designed, or your own teeth were designed to last forever, but how come they didn't? Okay, a lot of it is maintenance. So if you can maintain your own tooth, then you never have to get it pulled.
Okay.
Unless there's some accident case. Implants the same way because the body is a living organ, and anything that has life to it must be maintained.
Okay.
Dental implants exactly the same as your own teeth.
So at the top of the show, we said no more dentures, right?
Correct.
And so just so I have this right, that you say that the future of dentistry, traditional dentures will always be hooked on to something like dental implants?
Absolutely. The best treatment would be for lower denture, especially lower denture, because we don't have a lot of mass area surface area to attach the denture to the mouth. If you have a resorb ridge, which means bone has flattened out, it's very hard for the denture to stay in place. So I think every dentist should be treatment planning at least 2 implants to make sure that the lower denture stays.
So 2 implants, you get a full arch of teeth.
Correct.
And they just snap in, snap. What's the next level up for the denture wear?
With 2 implants, there's still some rotational issue. Food gets underneath in the back, but it will not dislodge. A better one is 4 implants. Okay, 4 implants, if you look at a table, 4-legged table is a lot sturdier than a 2-legged table, right? So 2-legged table, you need a wall to hold it up, or you need another person to hold that table up. So a 4-legged design on the denture on the lower would be very, very good.
So no more adhesive for sure on this on 4 implants.
Correct. 4 implants, it attaches to it. 0 mobility, no more adhesive. You're right.
Now you say you're changing people's lives by doing this. You believe that?
Yes, I do, Randy. Since 1996, all I've been doing is dentistry. 18 years from, actually, to tell you, I have not missed a scheduled day.
Is that right?
That's
perfect attendance.
Perfect attendance, how much I love this thing. Let me show you some cases how I've transformed a patient.
Okay, okay.
Here's a gentleman that came in and...
oh my goodness.
Is that new to you?
Yeah, I mean, that's got to be unusual, right?
To you, it might be unusual because he doesn't smile. Okay. I see that every day in my practice. Okay.
Really?
Some are a little bit less extensive. This is a very extensive case. He was referred to my practice because I changed his wife's mouth many years ago. And
I mean, what's going on there?
well, I mean, look at this. I mean, how can he smile with that mouth? I mean, I have to really force it open to even take a look at it because I say, hey, sir, can you smile? And he said, I don't smile. And we don't see it from the outside.
Okay.
We think something bothered them or they're moody or life is pretty sad somewhere else. But in actuality, if you open the mouth,
They're just hiding their teeth.
I wouldn't smile neither.
Okay.
Randy, you smile a lot on camera.
Yeah, I try.
You know why you smile?
Why is that?
Because you have beautiful teeth.
Thanks.
Okay. If you have teeth like that,
You don't smile.
I guarantee you're covered up. So I always say, you know what? If you have beautiful teeth, you show off your teeth. That's why we smile.
Okay.
Right? Now, I'm trying to smile today, but I'm so focused on this thing
Okay.
to try to get the message across. So he came in like this, unable to smile, hard to get along socially. I mean, when he eats, what does he tell me? He'd say it, I only eat with my lip closed.
Okay.
Okay. Because of the embarrassment. Okay.
So those teeth, what? They had to all go?
Yep. I saved 2 of the teeth there because they were clinically, criteria-wise, good enough to save him.
Okay.
Yeah, but the rest had to go. There was so much infection. His health was compromised due to it. And main complaint was his wife said, "Can you please help him because his breath smells so bad."
Okay.
That's sad. That's sad. Anyway, after
Wow.
many months of treatment, we were able to give him that smile. I pretty much changed him.
So those are dental implants?
Those are dental implants. He has about 20 dental implants in there.
Wow.
Yeah, quite a bit.
So it's like porcelain over the top, or what's on the top of that?
Just a regular, well-designed with a lot of characteristic, a lot of life to the tooth to give him back his youth. Yeah. So when he smiles, he doesn't know, or people don't know that.
Yeah, it looks like regular teeth.
Yes, they are. Good clinician and good laboratory. He's able to smile more. He tells me all about his wife came back and told me, "Thank you very much for fixing my husband up." Now they go out and they enjoy their friends.
So they can eat whatever they want.
Yes, they can eat food of choice.
So this guy was headed for dentures.
You know what?
Right.
He had a little flipper that that he couldn't keep in the mouth. He went to some dentist and it was a quick fix, missing a tooth, add a tooth, just to look decent, but it was non-functional.
Okay.
So with dental implants, we were able to anchor every tooth in there and give him his youth back.
Well, that's good. Okay, so you have other photos. What else are we looking at here?
This lady here, long story, she came from a third world country.
Okay.
She told me that never had a toothbrush or toothpaste for 5 years. That's depressing. So through the years, came to the United States, couldn't afford anything. She was on welfare. So I guess life is a lot better later in the United States because of opportunities, and she's able to do well, and I was able to fix up her mouth.
So what
her
happened?
complaint?
So what was going on there? I mean, those teeth had to go? And they had to be removed?
All her back teeth were all gone.
Okay.
She was wearing a little partial. A partial is a half denture with lots of wires around it to hang on to the tooth. And her main complaint is that it's uncomfortable. Food gets stuck in there all the time. And every time she leaves the door, she forgot. She forgot it at home. Because you take it out and you put it in the wrong place. Like I lose my keys all the time.
Yeah, okay.
Yeah. So anyway, she always forget it at home and have to come back and get it just to be socially presentable. So I was able to fix her up and change this lady. She smiles all the time, look a lot younger too because of all the support.
Looks good.
And the happiest thing is she's actually my mom.
Is that right?
Yeah, that's my mom. It's priceless to give her the smile that she deserves.
So what's her biggest benefit? Is it the eating part of it? Is it the smile part of it? Because like you say, she was missing all of her teeth.
Yeah,
Like for her, what was the best part?
all of the above.
Is that right?
Yeah. Eats whatever she wants, smile whenever she wants without any embarrassment, and she just go out there and just enjoy her friends.
Of all areas of dentistry, you've been doing it a long time.
Yes,
Happiest group of patients?
dental
The
implants.
people that you can...
Of the thousands of cases I've done, nobody has ever said, "I wish I haven't," or "I wish I didn't get it done."
So they all wish they would have done it earlier, obviously?
A lot of them said, "I wish I've done this 4 or 5 years ago,
Okay.
or 10 years ago, or 20 years ago." Some said, "I wish I met you before I became a dentist," which is impossible. So,
Now,
Yeah.
what's the next... I mean, if somebody wants a fixed set of teeth that don't come in and out, you do that too.
yes. Full mouth reconstruction. You've seen a few cases earlier.
But I'm specifically the denture wearers. If somebody wants to go from a denture to a fixed set of teeth on the upper and lower, you can do that.
Yes, I can. Definitely. I would do that all the time. Whatever my treatment plan is, whatever is good for the patient. That comes with many variables. Okay, it could be time, it could be finance, okay, or want. It's hard to gauge want because sometimes a patient want doesn't really coincide what they need. So I try to address need first, want. And if we can conducively put them all together, everybody's happy.
So you give them affordability options while they're there. Because insurance doesn't cover this, is that right?
That is,
Medicare doesn't cover it. I mean, but you have payment plans, things like that.
Yes, we do have all that at the practice. Some insurance, most insurance do not offer financial help to dental implants. But if you look at the long run, dental implants is a better investment long term than a bridge or a partial or anything else. Yeah.
Now we are just about out of time, but you have more photos. And,
Yeah.
and for people just tuning in, according to Dr. Key, no more dentures. You could get a fixed set of teeth in just a few appointments with 2, 4, 6, or 8 implants, get a full arch of teeth.
Correct.
And you claim it doesn't hurt that much, like virtually painless.
I'm telling you the truth.
Okay. And you could be 80 or 90 years old and get this done.
You can be any age.
Okay.
Okay, here's an elderly lady who's wearing a denture now. Okay, and her complaint is, I cannot eat anything harder than mashed potato.
Okay.
Because things are rocking and it's uncomfortable. So she came in, I just put 2 implants on the bottom, snap it on, and pretty much changed her lifestyle.
Very nice.
Yeah. So she goes out and she eats anything she wants, enjoy her social life. So pretty amazing. I mean, it transform patients' lifestyle and socially. I mean, the confidence they have, the exuberance they show in their face. I mean, you know, at that age, the muscles are not as strong as when she was 20 years old. So to give her that smile, I am one happy dentist.
And they become more positive
Yes, they are.
through this. I mean, when you smile, you're happier.
Yeah, because when you're at that age, what do you do every day? You eat breakfast,
Yeah.
you eat lunch, and you eat dinner. Yeah. Do you run a marathon anymore? No. You enjoy travel. When you do travel, Randy, when
Yeah.
you come back with a story, what do you say? Oh,
Food.
that food was so good. Right?
Yeah.
Yeah. So this is what I do. And here's another great case here
Okay.
to
Wow.
take a peek, look at it. This guy doesn't smile. I have to put that retractor in to make him to see teeth.
Okay.
And he said, he's my age, and he said, you know, I don't smile because of this. And then with a few appointments,
Wow. Very nice.
3 implant, we're able
Are
to give
some
him
of those dental implants?
that. I think 13 of them are dental implants.
Well, she pretty much replaced all of his teeth.
Yep.
with
And
dental
he was heading toward a full set of plates.
So this guy, these teeth were bad.
Bad,
They had
yeah.
to go.
The periodontal disease, yeah. A lot of infection in the mouth.
Okay.
Yeah.
Interesting. And it doesn't hurt? I mean, is this something where afterwards they...
When we say it doesn't hurt, no, it's sore, but you can alleviate it by ibuprofen, Motrin or Tylenol combination. Nothing that will debilitate them from their normal everyday living. I tell a patient, hey, come in on a Friday, by Monday go back to work as you normally do.
So they're never left without teeth.
No.
So there are thousands of people in and around your office that have an upper lower denture.
Correct.
And they just don't know their options.
Yes.
That's your take on it.
Yes.
Because they don't go to the dentist anymore.
Yes.
So what do you tell them? Because we're almost out of time.
If you see the show, give me a call, have a consultation, and I'll explain to you what your best option would be to help you out.
And we should mention, I mean, you've had a lot of training. You lecture, you teach other dentists. So tell me a little bit about your background and training after dental school in regard to dental implants.
Well, I've taken continuing education from Implant seminars run by my mentor, Arun Gog.
Okay.
He taught me so much over the last 13 years, and it's been a life-transforming, changing skill that I've acquired. Now I'm able to change lives because of it. So I want to tip my hat and thank him.
Yeah, okay, so you brought this book, and in this book, there's a whole, and this is one of the legends of implant dentistry. And
Correct.
he wrote about how positive you are
Yeah.
in the book.
Yeah. If you ask me, Randy asked me, how am I doing?
How are you doing?
Randy, fantastic. I've never had a bad day in my life. So that would be always my mannerism at home and in public. Because my background, I came from Cambodia during the communism time, and life's terrible. So to compare that to United States life, a bad day in United States is still a better day in where I came from.
So you appreciate all of it.
Appreciate every second of it.
Now these patients, because like you say, you're changing their lives. Do they ever give you a hug? Do they ever say, "Doctor, this is fantastic"?
All the time.
They do, really?
All the time. Bear hugs. Yeah. So that's one of the most satisfying moment as a dentist is when a patient comes in and say, I love you, Dr. Key. I mean, give me a nice bear hug. So
Is that right? Yeah. Good. So no more denture. You're going to wipe out. I mean, if it were up to you, denture wearers in Stockton, they would all be, and I don't want to put words in your mouth, but everybody would at least have 2 implants to snap in, snap out.
Correct.
At the minimum.
Correct.
But there's so many of them, if they all decide to come in for a consult, you couldn't even handle. Is that right? You couldn't even handle the need.
True. So true.
But they're afraid of the dentist.
They're afraid of this. Yes.
Of pain.
Of pain, of expense. The misnomer is that it costs too much. But dental implant is very affordable. The fee is similar to a 3-unit bridge.
And they could be, you could give them some sedation.
Correct.
To relax
Yeah.
during the process. So they don't feel anything during the process.
Or after. Well, I shouldn't say anything. They feel uncomfortable after.
Yeah, but
doing the procedure is very
But
straightforward.
isn't it true, if you've been wearing dentures for like 20 years, 30 years, that you don't have enough bone to get this done? Is that true?
False.
Interesting.
There's always bone in this area that dies that gets skinny slowly. So this area can always accept at least 2 dental implants.
Have you ever had patients that have come in that said, I was told elsewhere that I didn't have enough bone, and you were able to do the procedure? Has that ever happened?
All the time, Randy.
Really?
Yes.
So what is it you know or you're doing that's different? Does it come down to training?
A lot of it's training, knowing the biology of the body, and able to offer awesome dentistry.
And the way you do it, by the way, we should also mention, I'm not trying to side with you. People need to know it's a real interview here. But the way it's normally done is you go to one person to get dental implants, the surgeon. Then you go to another person that's the dentist that puts the teeth on top. You do it all together right there where you are. Is that right?
Right, Randy. I am a general dentist by training, so I do the surgery also. So I do the surgery and the connection on top of it to make sure everything is in uniform. So it's a one-stop shop dentistry in Stockton.
Okay, good. I want to thank you for coming on the show. It's a pleasure having you on.
Thank you, Randy, for having me, and my pleasure.
All right. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.